Why, hello there. My name's Dr. Timothy Fong. I'm a professor of psychiatry at the UCLA Gambling Studies program here in Los Angeles. I've been a partner and friend and colleague of the Evergreen Council for well over 10 years. I thought it would be really interesting to talk about some of the latest scientific findings around areas that many of us are hearing about for treatments for addictive disorders. Number one, transcranial magnetic stimulation. Number two, psilocybin. Number three, Ozempic, or some of the newer anti-obesity, anti-diabetes medication. And number four, artificial intelligence. So you may say, wait a minute, how do those four things relate to gambling disorders? Well, these are things that my patients have been asking about, families have been asking about. There's emerging scientific data about these four different approaches to treating gambling disorder. Again, TMS, psilocybin, the new medications for obesity and diabetes, and artificial intelligence. How can we use AI for the treatment of gambling disorder? And as a field, we've always needed and continue to need more treatments that are effective for gambling disorder. We don't have an FDA-approved medication. We have a number of psychotherapies that work, but we always need more. And we also know that so many of the gambling clients we see have other co-occurring disorders like depression, anxiety disorders, ADHD. We're also starting to see more and more research papers and thinking that TMS could help with addictive disorders like smoking, opioid use disorder, alcohol. So I definitely thought it's certainly time to review the state of the state when it comes to other new treatments that might be effective for men and women with gambling disorder. It starts with us informing ourselves when our patients ask right now, hey, I heard about psilocybin. I had a friend that did very well on their depression, and do you think it could help me? I think we're starting to see more and more stories about people who are curious about trying these modalities, TMS, psilocybin, Ozempic, as ways of treating their addiction. And I think it's important for us to be armed with the facts and figure out where this could fit into the treatment field for gambling disorder over the next 5 or 10 years. You know, Ozempic, Wegovy, a lot of these medications are a perfect example of that, where they were brought in predominantly to manage diabetes. One of the, quote, side effects, of course, is weight loss. And over the last 3 years, you see tremendous uptake of the use of these medications for weight loss without a lot of science to bear in mind. Along the way, we're starting to see more and more stories of people, in addition to not only losing weight, but also curbing their alcohol use, curbing their smoking, and in some cases, curbing their gambling and spending money. So it's really interesting for us to begin to think, is there a signal here where this medication could potentially be used in our field of gambling disorder? And I certainly we're going to review all of this in our keynote presentation. Well, as in any other field of medicine, when fresh, hot, new things come down the pipeline, right, and people get excited, and then everyone wants to try the brand new shiny object, right? Everyone wants to try and jump to a conclusion and say, we finally have something that actually can make people's lives better. That's the reason for a talk like this, is to slow us down and say, what do we really know about it? What are some of the potential side effects? What are some of the potential therapeutic good things that could come from this? So it's really designed as an idea for us to really review the current understanding, the current landscape, and to arm ourselves with proper way of informing our patients when they ask. So for instance, if a patient comes to me right now and says, I want to try one of these new things first, but they haven't done things that we know are effective, if they haven't done the scientifically proven treatments so far, I'm going to have some hesitation about it. But because people are asking now, I think it's definitely worth our time to review what's currently known out there, what's not known, and really give ourselves some tools so we can discuss these things with our patients in a much more informed practice.